You heard Republicans have an alternative to the administration's health care plan, and Congressman Bill Cassidy of Baton Rouge is here to talk about it. Now, are you asking the president to slow down, or are you asking him to say, let's take a look at the options that we are presenting?
A couple things. One, the president has put this artificial deadline so that we are going to have health care to him by August out of the House of Representatives. We're going to transform 16 to 17% of our gross domestic product between here and August. Now, there's no reason to have an artificial deadline. It's more important to get it right than to get it by some deadline.
All right. What would you, if you have a plan, what would you put forth?
If you look at it, folks need, there's actually two things insurance does now. One, it provides primary and preventive services, which everybody should have, and then it has a traditional insurance, so if you get in a car wreck or get cancer, it insures that. One is actually a purchasing pool, the other is actually traditional insurance. What I would propose is that we separate those two. Use something like a health savings account in which folks would control their dollar, be able to go to the physician of their choice to get that flu shot, those immunizations, the colonoscopies and pap smears, but then have a separate insurance policy that's for the unexpected risk.
Okay. Since we have so many uninsured, even in this state, how would you propose people get insurance if they don't have it with an HSA?
Couple things. About 40% of what a primary care physician's overhead is billing insurance companies. That's 40% that doesn't pay to touch a patient. If you're able to separate out this layer, make the patient central to the process, that's 40% more dollars you have to create vouchers or credits for those who are low income. And again, patients are in control. Costs can only be controlled when the patient is in control. I think the difference between Republican plans, or things I would favor, and what the president favors is he favors more bureaucracy, more government control. Medicaid for all, as some say. I think that's wrong.
Okay, let's talk about an HSA or a health savings account. If someone didn't have health insurance but they belong to a church, could the people in that church band together and make a health savings account on their own and go purchase insurance?
Well, currently, under current law, they cannot, but I think it would be a wise thing to allow that. We have a supper club, and there's two of the women who are so detail-oriented, they research everything. The rest of us would frankly take their recommendation. But if we went as a group to a physician for primary care, she would have to keep all of us happy because we would be a group of 10. And so now she is working for all of us to keep, no matter if somebody's particularly sick, she still has to keep her healthy to keep us all happy.
Okay, obviously this is one of those things that's not going away anytime soon, and we will wait and see if the August deadline actually comes to fruition. Yes. He's a doctor, of course, so he has some expertise on what doctors do. Thank you, Congressman Bill Cassidy. All right, government back.